Subscribe to our channel, press the bell icon and never miss an update from Latestly.
The laboratory expansion of ICMR is engaged. We are expanding our number of laboratories, and as we speak today, we have 72 functional laboratories in the ICMR system.
Coronavirus cases in India are inching close to the 150 mark, but the infection is still in stage 2 according to the Indian Council of Medical Research. With India's massive population but a relatively low number of infections, many are questioning the scale and efficacy of testing being conducted by government laboratories. Currently, the ICMR has tested nearly 11,500 people across India until March 17, 2020.
The laboratory expansion of ICMR is engaged. We are expanding our number of laboratories, and as we speak today, we have 72 functional laboratories in the ICMR system. This is ICMR, Ministry of Health system. We have also engaged non-ICMR, Ministry of Health, government laboratories include CSIR, DRDO, DBT, government medical colleges, and we have 49 of those labs which will start testing by the end of this week.
India's population is largely dependent on the private medical industry. About 5% of the Indian government's annual expenditure goes towards healthcare, one of the lowest in the world. According to the World Health Organization, most of the healthcare expenditure in India comes from private spending of households. Which is why, with the rapid spread of coronavirus, the involvement of the private pathology laboratories is being looked at by the central government.
ICMR is also engaging with high-quality private laboratories that include NABL accredited laboratories to understand the modalities, to increase access to the test while ensuring appropriate safeguards.
In order to increase the scale of testing, ICMR has made an appeal to private laboratories to offer COVID-19 diagnosis and also issued a license to Swiss firm Roche Diagnostics in India to test for SARS-CoV-2 diagnostic test. Meanwhile, Trivitron Healthcare and My Lab Discovery Solutions have said they are still waiting approvals. But the tests conducted by the government as of now are free of cost. The first test for COVID-19 costs about Rs 1,500, and if a second test is done for confirmation, the combined total cost is about Rs 3,000, which the government bears. But the estimate is that private testing will cost an individual around Rs 10,000. So the big question is, who would then bear the cost of COVID-19 tests? The ICMR has reportedly appealed to the private laboratories to offer COVID-19 diagnosis at no cost, but this rollout is still in the pipeline.
Guidelines are also issued for private sector laboratories intending to initiate COVID-19 testing. To detail, laboratory tests should only be performed when prescribed by a qualified physician as per ICMR guidance for testing. ICMR has strongly appealed that private laboratories should offer COVID-19 diagnosis at no cost.